Hi, my name is Marissa Bartmess. I am a PhD in nursing candidate at the University of Tennessee, Knoxville, and the lead author for this study, It Would Be Nice to Think We Could Have a Voice, exploring RN involvement in hospital staffing policymaking. We know that hospitalized patient and nursing outcomes can improve when nurses are involved in decision-making practices, such as policymaking through power-sharing structures. But how are staff nurses involved in hospital staffing policymaking, and how do they perceive this process? Together with co-authors Dr. Carol Myers and Dr. Sandra Thomas at the University of Tennessee, Knoxville, we sought to address these questions. We used a qualitative descriptive approach. Using an online form, we sought open-ended responses to semi-structured questions to explore how staff RNs were involved in hospital staffing policymaking. 32 staff nurses from 14 states and the District of Columbia completed the online form. Identified themes include: we aren't asked, structural barriers to staff nurse involvement, no one cares, workplace culture barriers to staff nurse involvement, and lastly, they versus we, a lack of power sharing for staffing decision making. Nurses described feeling powerless with regard to and having little to no involvement in hospital staffing policymaking. Yet they also expressed their desire to be engaged with this process and highlighted why their involvement is important. Their perspectives and experiences are powerful and point toward changes needed to improve nurse involvement in hospital staffing policymaking. We hope you enjoy the article. We also hope that the findings spark much needed discussion for policy and practice changes in this area.